Welcome to the Total CEO. I'm Adrian Avila, and here with me are my business partner Sharon Kuhn, and she has invited a very special guest to attend with us today. So, Sharon, why don't you just take it from here?
All right, thank you, Adrian. It's really exciting to have Dr. Peter Reich with us. Dr. Peter Reich earned his Bachelor of Science degree from the University of Massachusetts and Doctor of Medical Dentistry from Tufts University, Boston, Massachusetts. He then continued his training at Johns Hopkins Hospital, where he worked for 2 years, serving as chief resident in his last year. Dr. Reich completed his hospital-based specialty training in oral and maxillofacial surgery at Seton Hall University. Dr. Reich is a board certified oral surgeon and has been in private practice on the Seacoast since 2002 and maintains his office in Dover, New Hampshire. And Peter, I so appreciate the voice that you bring to our podcast today. Thank you for being here.
Thank you. Thank you very much. It's so nice to be here. I'm excited to discuss these exciting topics.
Well, it's really exciting when I meet doctors who are enthused with the science of empathy, and that's how we kind of got on the same page together and shared so many perspectives on empathy in patient care, empathy in person-centered care, and just empathy even in the business and systematizing of medicine and education. It really empathy is that human component. So Peter, I've heard you talk eloquently and heartfully about empathy in your practice and empathy in dentistry specifically. Looking back, what role has empathy played in the way you've practiced throughout your career?
Yeah, it's been so nice discussing this with you, Sharon. It's triggered so many things with empathy, and it's been so easy and flowing. Um, y- I really started my career. I went into dentistry because I liked science and medicine, and I knew I liked to help people, but it was always in the back of my mind. But when I got into dental school, really wasn't until my third year. I was on a rotation for oral surgery, and I encountered people in real pain who needed dental extractions, dental infections. And that's really where I found my passion. And it's why I went into oral surgery, which was a 6 year commitment after dental school. I went into dentistry to help these people. It really triggered a response in me. I wanted to be the one to be able to relieve that pain.
Mhm.
I had a patient, very angry patient presented. Patients oftentimes present angry just because they're in pain, they're afraid. And I was able to really spend time with this person, calm him down, extract the tooth. It was like the second tooth I'd ever extracted. And he was so relieved and so happy after. I never forgot it. And it really lit my fire to want to help more people.
I love that story, and you have shared that in our conversations, and it just touches me every time because I've been that person. Now, I wasn't the person who would very easily act out angry. I was the person
Right.
who would be frozen, right?
Yeah.
And for doctors to be
Right.
able to read those things,
Yep.
and that's one of your strong suits is being able to kind of read the need there.
Yeah, it's so nice to know, if you have the knowledge of what you can do to help somebody, it's, a blessing to be able to help someone. And, it just continued to expound from dental school to residency. In residency, you see more severe cases, more severe injuries, cleft palate, you name it. There's so many things where you're able to help people. Um, but I think it's important to carry that into private practice once you enter the workforce, either from a dental student aspect or oral surgery aspect, to carry that into private practice because there's pressures all along the way to try and speed up treatment, be more productive, do perfect dentistry. And I just think it's very important to not lose sight of that patient that's connected to that tooth. It's very important.
Where
Yes.
would you
I,
recommend that somebody starts? So we're talking about this thing of empathy, and we're talking about how we need to bring it into the private practice. And this is something that you actually did. This is something you actually lived out and experienced for a long
Yep.
time. So where would somebody who's new to the industry, new to dentistry, new to whatever, where would they start?
It's a really good question, and I've thought about that quite a bit. And I really think it all starts with just having a mentor, having somebody, be it, a teacher in undergrad, a teacher in dental school, somebody, a colleague, a friend who's doing the same thing you're doing. Just somebody you can bounce ideas off of, but that, who lights that fire in you when you're just talking about doing this, this, and that. Someone who reminds you, well, what does the patient want? Are you just doing this because it's the perfect treatment or it's the most expensive treatment or have you asked the patient what they want? Because every single time I treat a patient at this point, I'll never forget, I had an attending who really told me, like, you can have a perfect treatment plan, but it may not even be what the patient wants.
Mhm.
So, I'll usually give the patient, five, six options and like a menu they can pick from. And then I know where they're starting. I can still further explain the benefits of A, B, and C if they want D. But I think if you're starting at a point where the patient agrees with the treatment plan, you're starting at a good place. And then you can help understand where they're at based on their decisions, if that makes sense.
Absolutely. Yeah, absolutely. And then I remember, Peter, you talking about the amount of time that you would spend with a patient and how
Yeah.
you see that being really crucial to understanding their needs. Do you want to speak to that?
Yeah, I would love to. I mean, so at this point in my career, I've done full scope oral surgery, cancer, head and neck surgery, cleft lip and palate, all the way down to
Oh,
now I'm just specializing in TMJ, and it can be a complicated history you have to get through. And I have found over and over again throughout my career, the more you speak with someone, you get more and more information that can help their treatment plan. So my advice, to a dental student or a new doc in private practice, you're going in to meet someone for the first time, you read through the medical history, and you start to develop a treatment plan. But there's a lot more information oftentimes in that person, in past experiences, past medications they may not want to tell you about. In TMJ specifically, I have to ask people because they're embarrassed to put down on their history if they're on a antidepressant and anti-anxiety medication, and it can affect their treatment. So once you get to know them, you just bring it up kindly, softly. Is there, any history where you've taken these medications? And it's important to just open that line of communication where they trust you, where they feel they can speak to you because you have their best interests at heart.
Do you
absolutely.
think that this is something that a lot of times what we find in like the corporate world today is entities try to systematize what you're talking about there. They try to put together a script of questions that you're supposed to ask in order to uncover that information, and it kind of takes that human element out of it, right? It's a script. You're reading off a script. It takes that connection away. And so, what do you think is an adequate amount of time to really be able to spend with the average customer? Because that's another thing that's going to get thrown into this too, right? The reason why they're going to systematize it is because you only have this 25-minute slot to take care of each
Right.
patient. So, how do you
Right.
combat that?
Yeah, I mean, it's a really good question again, and it's not complicated. It's just it has to be a human interaction, right? It's like you said, you can't just be reading off a script A, B, C, D. There's already a checklist they filled out when they came in there. I just find it's so important for the patient to really realize that you care about the treatment. You're not just there to sell something, you're there to understand what's going on with them and try and help them address it and fix it. Um, so it's not just a checklist, it's just a discussion. You just have to be human and have a discussion with them. Of course, kind of like a pilot before he takes off, there's basic information you have to know. And so you have to go through that first checklist, but then you go off script and you start talking. How was your weekend? How was the holiday? How was the new year? What did you do? And you just start finding things out about people and it can explode positively from there.
And that makes me come back to the signals of trust. So, the reason that our discussions brought us together is the concept of empathy in patient-centered care is saying that the way the person who is the authority is signaling comfort, signaling presence, signaling being grounded. If they're not grounded in themselves, they can't signal that to their patient. And I would like to remind us and our viewers, our listeners, that we're trying to read those signals hundreds of times per second. The body is doing that for us, isn't it? And we can all think of a time we've been in a doctor's office or a dentist's office, and we know our body is feeling all the signals going off, going off, going off.
Yeah.
And it is, I feel like one of your gifts is just that calm, soothing interest, compassion. And empathy is not being hypersensitive so that we're going to be drama related and get sucked in to our guest, our client, our customer, or our patient's situation. It's going to be to empathy would be to relate to them, identify with them, feel their feelings, but not lose our own perspectives, our own groundedness, because we are who they are grounding to in those moments.
Yeah, it's a very good point you make. The comfort level of the doc and his understanding of the material can be felt oftentimes by the patient. I can remember back to some of the complex surgeries I did when I was first starting to do them. And I found myself when I was discussing it with the patient saying the same thing over and over, almost like I was trying to convince myself of it. And I know I've changed, in the past 30 years. And I do at this point feel so comfortable with the material I discuss with a patient. And oftentimes the patients will acknowledge that and just say, "Oh, it hasn't been explained to me like that before. Oh, now I get it." Um, but I was just as guilty in the beginning of kind of rushing through things. You're a little nervous because you don't really understand everything about a treatment and so on and so forth. So I think you raise a good point. And that's where I think a mentor can really help a new dentist and a dental student get through that because everyone goes through that.
It reminds me of maps. Adrian and I talk a lot about maps. And here's the thing, right? When we're new at something, if we're given permission to feel that anxiety and we have a mentor relating to that anxiety, we have a map to look at that from a higher brain. We really do. This part of our
Yeah.
brain is looking at that in a sense of belonging with someone else. And
Yeah.
so it's a different level of nervousness. It's more of it could be nerves, um, but not feeling maybe as inadequate. It's that brain. If we have that mentor, we've got the chemicals coming up to the front brain. We've got those belonging chemicals. And because of that, we're going to be able to keep our front brain online for our patient and not
Yeah.
be as reactive, which if we're reactive, we're going to be heading into error. And that's what another thing that we've talked about that's so important in business, in dentistry, in medicine, in anything where we're serving our client, our patient, our customer, is that we're not making errors. Adrian has a construction company. He doesn't want errors to go on, in a home that he's got his contractors working in. I have, I was just at a house 25, 30 minutes ago and working with my client on getting some lab results. When we're present, they feel so different. If we have our empathy online, we literally have our front brain online. And that's what they're feeding off of. And that means critical reasoning. That means emotional awareness without being emotionally hyper emotional. We're not talking about, being overly sensitive. We're talking about being emotionally aware.
I
And,
think
Hmm.
and
what it is, it points to your idea of co-minding, right? Is ultimately what we're getting at. And so I don't want to steal your coin
I
term
love
there,
it. No,
but
go.
you have this idea of co-minding. And so, Peter, when you're talking about having a mentor, For me, I mean, with where I'm at in life, I'm only where I'm at because of the mentors that have helped me get to where I'm at,
Yeah,
and
it's
it
true.
ties back to Sharon's idea of maps, right? I didn't have maps to get to these places, but people with experience had some ideas and maps to give me that I could at least walk some kind of trail and path along, right? And so all of that is so powerful. So I just want to kind of help for the people that are listening right now, like pay attention to the idea of we're saying slow down. Remember, there's a person attached to that tooth. Get to really understand the person, find out who they are, and then for the behind the scenes, right? That mentorship and this co-minding, Sharon. I want you to speak to that a little bit if you don't mind, and then just see what happens here because this idea of co-minding within the workplace, having mentorship, that right there is the secret sauce to being able to provide consistent top level patient care.
All right. And we know, and as Peter and I have talked, and as you and I have talked, we know that the system that is serving our patient, our customer, our client, if the system is cohesive, right, then we're all co-minding. And I used that word in a Forbes article because I was describing co-regulation. And I used to get all
Hmm.
this pushback on co-regulation, like, what are you even using that terminology for? And I'd be like, no, it's real. Like you're putting two minds together, which means your bodies are responding. And so as we co-mind or co-regulate, we're actually tripping the switches of genetic enzymes and the immune system and the endocrinological system, and all these things are going to help the patient have a strong or a poor recovery. The piece of empathy and the science of empathy coming into medical care is just so powerful. So yeah, can you think of times when you know that that patient was feeding off of you? Or a case when you were kept from a patient who desperately needed you.
Yeah, well, and just to go back one little step too, I would just add to the co-mining thing, for the young docs out there and is shedding the ego, I think is so important because then, you're not able to truly co-mind or work with a mentor. You have to shed that ego, say, I don't know everything. And when you shed that ego, you're you're shedding some of the anxiety you have. Some of the anxiety young dentists and things that these young docs are experiencing, it's because they don't truly understand or truly know how to do a new technique. And you can't go charging in there saying pretending you know how to do something because that's going to create, you can talk to the neurotransmitters and that, but that doesn't feel good. And they're
Mhm.
not going to feel good. The patient's going to feel it. And certainly in the medical field, you're really held to a standard where you're really expected to do everything perfect. And no one can be perfect 100% of the time. It's impossible. So it's so important to go into that, shed your ego, work with your mentor, talk to the patient, but then say, hey, we're going to do this. This is the best treatment for you. But A, B, and C can go wrong. Acknowledge it up front. Don't hide things. Don't tell them, oh, this is going to be so easy for you. You're not going to have any pain. You don't truly know that. And it's really stress relieving for the doc if they can shed their ego and then inform the patient ahead of time that certain things could go wrong, but we're going to work with you, it's unlikely, etc. And then I'm sorry that you asked me about an experience. I forgot
Yeah, does
already.
anything come to mind? Because I know you shared a few experiences with me that, either a system kept you from a patient who needed you. I'm thinking of someone coming out of jail or going right back, or
Oh yeah, yeah, this
and you were up
this
against the
yeah.
system, and your empathy drove you to try to address that system, and the system wasn't up for patient-centered care or really human, prioritizing the humans, right? And so, should
Yeah.
we address, do we want to go down that road?
Yeah, absolutely. I mean, I was pretty passionate at the time. I was a new doc out of residency, on trauma call. So we would see multiple car accidents, gunshot wounds, all kinds of things. And on this particular day, there was a patient had been in an altercation in jail, had a severely broken jaw. And it
Mm.
was a complicated case. So, I went to the hospital, to the OR. I wanted to take it to the operating room like immediately to try and treat this. And I was met with resistance, so much resistance that they didn't want me to do it until the next day. And I felt that was inappropriate. So I took it all the way up to the CEO of the hospital, who yes and no'd me to death, but they still wouldn't let me do it till the next day.
Mm.
So there you have a whole system. You have the OR staff, you have the nurses who have all been told this is not a priority based on who I don't know for sure, but you could say their remuneration for it wasn't going to be as much as other cases, but um, it can be profoundly affecting a new doctor because you're learning from the system. Oh, okay, so it doesn't matter. We don't always do the ideal treatment for certain people, and it just I was proud of myself for standing up for that and getting and speaking my mind. But it goes on and on where they try to then tell all of those staff, yes, this is how we do things in this hospital, and tried to make me feel bad about it when I was just advocating for the patient. So I've lived my life always trying to advocate for the patient, even if other professionals or other systems in place didn't like it. I think you have to, I think that's another thing that will be fulfilling in your career and make you enjoy things more if you really stand up for what you believe and push forward, I think.
And
Can, go ahead.
go ahead, Adrian. No, I won't forget this.
Yeah, let's talk about, if you don't mind, we were talking about shed the ego, and then we're talking about stand up for what you feel is right.
Yeah.
There's a very fine line. I mean, it's a pretty common sense, clear difference between the two, but let's talk about what that means from like a state of humility, right? At what point do you stand up for yourself versus I know it all, right?
Yeah.
Because you were barking up a tree, as some would say, that is a pretty tough tree to bark up, and but you stood up for yourself and you did what you felt was right, which I think anybody listening to this would be like, yeah, take care of the gentleman, right? Like, who cares the situation?
Hmm.
Take care of them. Anybody's going to think that that's reasonable, but you were fought back. And ultimately, they won, kind of, right? So, what's talk to a little bit of difference of that, of like, okay, ego versus standing up for what is right and ultimately doing what is right for the patient.
Yeah, the ego part is, like I said, we're all expected to be so perfect all the time. But if you come up with a treatment plan that you're on kind of, inside, not sure if this is the best treatment plan going forward with a patient, don't hesitate to pick up the phone and call a colleague and be like, hey, I kind of want to sound this off for you. What do you think about this treatment plan for this particular case? Don't think you know everything. Reach out. You learn so much from other docs. I've been I've been an inspector for the state for over 20 years for anesthesia, and I go into multiple oral surgeons' offices and we inspect their anesthesia and we discuss. And I'll tell you, nearly every time I go into an oral surgeon's office, you sometimes will pick up a little bit, a little tidbit on something you might do a little different, or a piece of equipment might be a little better. So I think if you realize there's so much out there to know and stay open to try and get as much information to help your patient, I think that's where the ego part comes in. And yes, it's a fine line in a situation like I discussed, where you're going to hold a fine, draw a line in the sand. Um, but we take our boards. It's an oral exam. It's a brutal exam. Oral surgeons who pass their boards really have a firm understanding on the basics of things you don't want to stray past. And this was one of those moments. And, if that had been a board exam, they would have wanted me to do the same thing because a broken jaw is an emergency. Is a broken leg an emergency? Like, would you want your daughter to wait 24 hours when they could fix it that night? There are complications that can happen if you wait. So no, there are basic rules we have to follow, and I think those are worth standing up for.
What I want to say about what just happened there, watching you speak about that, is when you're talking about the ego, it was all about the self. The moment you talked about standing up, what I was saying, how did you stand up for yourself? Really, you weren't standing up for yourself. That's where the empathy card is played, right? You were doing ultimately what is right for the patient. And then what I love
Right.
about your logical sense there was, as you said, if this was a board test, they would say operate, take care of it now, right? And so
Exactly.
you're backing logic with emotion, all in such a right direction that it makes sense. It's so logical. And so I think it's very powerful for people to just hear how simple this is and these different stories and these different scenarios of how to be patient centered first, leading with empathy, setting yourself aside just for a moment to do what is right for the patient.
Yes. Yeah,
Well
exactly.
said. Peter, where I was going to go, and that's perfect with where I was going to go, was that, we can't regulate a self we're not aware of. And when we have a mentor, they're kind of mirroring to us this acceptance, and we have an increase in confidence, an increase in self-awareness. And because of that, we can self-regulate. Because of the empathy and the mentor, that person is not just humble, but they have meaning in it. They're passionate, and that is what is the fireproof protection from burnout. Can you
Mm.
speak to burnout for docs and how that affects patients?
Yeah, burnout, so I've been in the private sector for 30 years, residency 6 years, dental school 4 years, and I have seen all levels of burnout. I've seen students in their second, third year of dental school burnout and quit. Um, and, I've heard of it, the same thing in medicine. I mean, it is a stressful field. People are coming to you in pain, and you're going to be, giving them local anesthesia, a needle. They're not happy to see you. So burnout is a tricky thing. You got to, I think, this is my humble opinion, you've just got to always be cognizant of why you entered the field. For me, it was wanting to help people and doing everything you can to try and improve on that. So the continuing ed, all that's fun, but if you're, I've told this to my kids too, if you're in something for the wrong reason, it's just not going to work out in the long run. So I think it's so important to get in touch with why you're in something. Um, if you're in there to just make a ton of money in medicine, I think it's a recipe for disaster. And the docs I've seen who have succeeded and done well and are healthy, they have a very nice balance of maintaining that empathy and enjoying helping people. I mean, there's dozens of mentors kind of ringing through my head about, you know, in dental school, I didn't love making dentures for people. It just wasn't my thing. But, there was a mentor of mine who every time one of his denture patients smiled, he was like so happy. Um, you deliver a new denture to somebody, and all of a sudden now they're putting on lipstick, they're combing their hair. Like there's little things. And it goes that way in, oral surgery. We do orthognathic surgery where you can reshape someone's jaw and face, and it increases their self-esteem. So find the procedures that you like, where you feel you're helping somebody, and everything else will come. The hours, the money. I feel like everything else can come after that. I strayed a little there, but I hope I stayed on
No.
topic.
I love that because in our former conversations, we've talked about how you're going to get residual business. And another thing I was thinking about was, there's a person attached to that tooth, and there's a soul and a heart attached to that person. And they're going to go out into the community and help people come to the safest doctor.
Hmm.
Okay, so the empathetic doctor that isn't placating, because we've also looked at research how AI can like try to draw out all this information, use empathetic language that isn't necessarily going to be like really, maybe if the doctors haven't been trained in this, in these person-centered skills and the soft skills, right, behind the hard science of
Hmm.
what they're actually doing for the patient. If the doctors aren't skilled in that, then they're going to see this empathetic language as they're working with a bot to get their appointment and get all kinds of things set up in the kind of Yeah, and the in all getting all their information loaded in for the doctor. And then if the doctor can't show up and have those soft skills, the residual business is not going to be the same, is it?
No, they won't even want to buy into a treatment plan that can help them so much if you don't make that connection with certain people. I mean, the older I get, the more and more I've realized, and you keep learning, but people are suffering. People are sitting in your chair, and there's obvious suffering, right? An infection, a broken bone, but there's silent suffering too, where these people, are going through emotional turmoil for multiple reasons, divorce, death, this, that. And if you can just, that human touch, just empathize with them. Like I can think of so many people who are going through a lot. It's almost a joy to have a moment to sit down and discuss with them and try and get them through another hard part of their life when they're already going through a lot of difficulties. And believe me, they are so thankful for it. And like you said, then that translates into your practice getting busier and busier because they go out into the community and they tell other people who may be suffering or not that this doc really cared and was trying to do his best for me. And yes, you will have a successful practice. You'll never be at want for patients. I truly believe that.
It's
Um,
awesome.
yeah, and if I could jump back, I just thought of this. The whole fearful situation thing about a mentor. I was just in the Caribbean, and I was snorkeling with my daughter. And I'm like, oh, just go out and snorkel by yourself. She's like, I'm not going out there. There's sharks out there. Da, 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 da. And then I started going out. She's like, well, I'll go out with you. It's kind of like that with a mentor. If you're with your mentor and you're doing new things, that fear, that anxiety, that burnout may be less if you can work with people until you're up to speed on something. That was just a thought I had. Thought I'd
That is so
throw it
perfect.
out
That is
there.
so perfect.
Yeah,
That's the whole big thing is that when we have psychological safety and bonding,
right.
we have trust, and we're not afraid to ask for what we don't have. So we've got security built in.
Hmm.
Insecurity is going to make us feel like we need to take care of ourselves or kind of cover our own self. That's going to be self-focused, and that's going to be a nervous system survival mode, a coping mechanism on our part, whether whoever we are, serving
Mm.
anybody, whether it's our child, our patient, our customer, our client, whatever. So yeah, giving people tools to understand their level of maturity in these soft skills. And if they didn't have a dad or a brother or a partner, a business partner, otherwise, that they could say, I want to come along with you in that. If they don't have someone for that belonging, their body is in a coping mechanism, and that coping mechanism will wear them down. And then they don't get to be
Yeah.
who they truly are.
Yeah, like lack for a better word, you could come up with a better word, but like the imprinting, like if in dental school you're not imprinted or taught these
Mhm.
things,
Mhm.
you may not find them until it's almost too late or until you're burned out or etc.
Learning the hard
Oh, I
way.
love it.
Yep, learning the very hard way. I mean, we all learn from our mistakes, there's no doubt.
Mhm.
But to minimize major mistakes where it could be, career ending or burnout producing, yes, learn the bad hard way.
Actually, Peter, I remember if we could extend this a little bit more, and I know that
Yeah.
we've touched on a lot of great points. I remember you talking about, and you touched on just a little while ago, is that if you're telling a patient this and this and this could go wrong, or these are the things that we can't guarantee because your body isn't like anybody else's body that's ever been born or that will ever be born. So we can't control all these things. But if I'm Dr. Reish and I have a degree of security and humility, then
Mm.
when I deliver that information, I'm not making it about, I'm not withholding any of that information to mask some fear that something could go wrong. I'm confident that my patient and I together are going to walk this journey together and discover what that is for this patient. And
Mhm.
I really appreciate it in our conversations. You're being able to expound on that, and that would be a big burnout piece for docs, is that if
Yeah.
they've had to kind of cover and not want patients to think things are going to go wrong, and then if something goes wrong, it's even worse for them. What a nightmare. You would feel so on fire with stress if you
Hmm.
don't feel secure to really help those patients know all the pros and cons that together we're going to walk through. It is the together part, isn't it?
Yeah. I mean, I am so careful when I discuss treatment plans with patients. Even though they're looking for your opinion, it's a very fine line between giving it to them in the sense that I never say, I would do this. I don't just say, I would do this option. This is the option that I would choose. And you should do this too. It's more like you said, and we've discussed this before, but a menu, depending, but roughly it's always between 3 to 5 options for any particular surgery. So, you have this menu of 5 options, and A is the kind of ideal, money doesn't matter, state of the art kind of treatment. And for various reasons, or people can't afford it, there's B, C, and D. And then there's potential complications with each one. And I lay it out. And many times patients will say, well, which one would you do? And I kind of refuse to say, I'm like, I'm not you.
Mm.
I'm listening to you. Which one sounds best to you and why? And then you go from there. Because if they pin you in that corner and you're like, oh, well, I think this is the best one, and then something goes wrong, they're like, you said that's what you would do. I feel it takes a lot of stress off the doc, and you're still doing right by the patient.
I love that. It takes stress off the doc and you're building credibility with your patient. So
Yeah.
very, very
And
good.
sometimes there's only one option. But that's pretty rare because there's really almost always an option of no treatment, right? You technically don't have to do a lot of treatments.
Mhm.
If it's a broken bone, yes, you have to fix it. There are different ways, but so on. Yeah.
So, mitigating fear through empathy and elevating outcomes through empathy and reducing burnout through empathy and having resilient business and residual business because of empathy. This signaling of this human piece is powerful. And I am so thankful for all of your input today. Are there some things that we should still expound on, or does that kind of tie it up for us? I don't want to miss anything. We can go back.
Yeah, no, I think it's good. I would just add to the burnout factor. So we've discussed a lot about the fear and anxiety of a young doc um, adding to burnout, but the overworking of a young doc too can add to burnout. And I think in the world that we're in currently, a lot of young docs are overworked. They're working for a practice that schedules for them, and they're scheduling too much in a day for a young doc to get through comfortably without being stressed the whole time. So I just think overworking is, you have to be careful. Like with my TMJ patients, I know I'm older now and it's different, but I really enjoy scheduling, a good 45 minutes to an hour just for a consult to get to know them. Um, a consultation is very important, but in the business world, you don't get paid a lot for a consultation. So consultations, from what I've heard in the medical world, have gotten smaller and smaller. And it's hard to get to really know someone's history, let alone get to know the patient in 15 minutes.
Mhm.
And imagine if you had 30 new patients in a day.
No.
I
And
mean, can you even imagine?
no. And as a patient, your immune system is not feeling safe. That psychological safety, there's not time to imprint that, like you said earlier, that psychological safety. There's
Yeah,
no
no,
imprint of that.
right. Those patients are walking out of there going, he didn't even ask me about that, and that. And it's like,
Hmm.
yeah,
Hmm. Yeah. Yeah.
yeah. So I just wanted to add that.
Excellent.
Well, for all of the people out here that are listening to this for the first time or getting to meet Dr. Peter Reich here for the first time, one of my mentors told me that a wise man learns from his mistakes, an even wiser man learns from others' mistakes, and the wisest learns from other successes. So you have a lot of success that you're dropping here, and so extremely wise people should take to your advice, sir.
Love it. Love
Yes,
it.
thank you. Beautiful. Absolutely. Absolutely.
Thank you, Aiden. That was well said. Very well said.
We appreciate the people who are listening, and we appreciate that we have the opportunity to bring this to listeners and to doctors and to patients because our doctors are being just as systematized and harmed by the way we're building our medical systems as the patients sometimes. And that's why these voices encourage them, right, as much as the patients to look for that empathy and wrap around that empathy and believe in their own human person is what they're bringing to their patient. So thank you so much, Dr. Reish. It's been awesome having you.
Yeah, thank you. Thank you. This has been a great process discussing this. And it just kind of cements how, yes, the patients were thinking of empathy, but helping other docs empathetically has been kind of a new discovery for me, specifically in this process, how the imprinting and behaviors we can learn to truly help other docs.
Love that. Absolutely. Thank
Thank
you so
you.
much. Yes, thank you so much.
Thank you guys.
Thank you.